Men over 60 who continue their intimate self-care practices exactly as they did decades ago may unknowingly be creating serious health complications that could impact their circulation, prostate function, and nervous system integrity. After practicing urology for 25 years, I have witnessed firsthand the devastating consequences when mature men fail to modify their approach to accommodate their evolving physiology. Let me share with you the essential knowledge about maintaining safe, intimate wellness after 60, the 3 devastating errors that might be endangering your health at this very moment, and the critical symptoms that demand immediate professional medical intervention. I am Dr. Evelyn Hart, a board-certified urological specialist with a focus on mature men's wellness. Throughout my quarter-century career, I have provided care for countless men who faced complications stemming from their lack of understanding about how intimate self-care practices must evolve with advancing age. While this subject rarely receives adequate discussion in medical settings, it absolutely should receive attention because intimate self-care after 60 can either enhance your well-being or create significant harm. The determining factors include proper technique, appropriate frequency, and recognizing when professional evaluation becomes necessary. Allow me to begin by establishing the medical foundation. Intimate self-care does not become medically contraindicated after reaching 60 years of age. Actually, regular and gentle self-stimulation promotes prostate wellness, sustains healthy circulation, and helps maintain sexual functionality. However, your methodology must undergo modification because your physiology has transformed. After 60, multiple essential systems that influence sexual response experience substantial alterations. Your testosterone production decreases approximately 1 to 2% annually after age 30, with this decline becoming more pronounced after 60. The vascular network supplying your genital area becomes less flexible due to modifications in collagen and elastin proteins, causing erections to develop more slowly and become more challenging to sustain. Your nerve receptors experience diminished sensitivity, a condition neurological specialists term age-related sensory deterioration. The speed of nerve signal transmission decreases, meaning communication takes additional time to travel from your genital area to your brain and return. Most significantly, your recovery period extends considerably. Your refractory phase, the interval required between climactic experiences, can expand from minutes during your 20s to multiple days during your 60s and beyond. What most men fail to understand is that when you do not modify your intimate self-care approach to accommodate these physiological changes, you risk creating permanent damage that impacts both solitary and partnered intimate encounters. I will guide you through the 3 most hazardous errors I observe in men over 60 during intimate self-care. These mistakes can result in nerve injury, prostate inflammation, and circulatory complications. Subsequently, I will provide my comprehensive protocol for safe, intimate self-care after 60, featuring specific positioning guidance and product recommendations. Finally, I will address the particular warning indicators that necessitate urgent medical evaluation and how to navigate that potentially uncomfortable discussion with your healthcare provider. This information may prevent you from developing conditions that prove difficult and sometimes irreversible. The initial and most destructive error involves employing excessive pressure and grip intensity. When men observe decreased sensitivity, with aging, their natural response involves gripping more firmly and applying increased pressure. This represents precisely the incorrect approach and may cause irreversible damage. From a urological standpoint, the male organ contains delicate erectile tissue known as the corpus cavernosum, spongy compartments that become engorged with blood during arousal. This tissue receives support from sensitive neural pathways and minute blood vessels called capillaries. When you apply excessive pressure during intimate self-care, you compress these structures and may cause lasting injury. Over time, this compression may create what we identify as pressure-induced neuropathy, essentially nerve damage resulting from repeated trauma. I have treated men who developed permanent loss of sensation in portions of their genital area because they consistently applied excessive pressure during intimate self-care over years or decades. Excessive grip may also damage the small blood vessels that supply the male organ, resulting in reduced circulation and difficulty achieving erections even during partnered intimacy. This creates a destructive pattern where decreased sensitivity leads to increased pressure, which causes additional damage and further reduces sensitivity. I have had patients inform me they can only achieve climax with an extremely firm grip, so intense it would cause discomfort with a partner. This represents clear evidence of nerve damage from years of excessive pressure. The medical solution involves what I term pressure titration. Begin with the gentlest touch that produces any sensation whatsoever. If you cannot detect light pressure, the problem is not that you require more force. The issue is that your nervous system requires additional time to respond. Allow 60 to 90 seconds for nerve pathways to activate before gradually increasing pressure. Never grip so firmly that you completely compress the shaft. Consider it gentle massage rather than mechanical manipulation. If you are finding this information valuable thus far, please subscribe to Vital Hormone. My upcoming video will expose the 3 most significant erection obstacles that have no connection to testosterone levels, and you will not want to miss this crucial information. Now, let me discuss the second critical error I observe in men over 60. The second critical mistake involves engaging in intimate self-care too frequently for your age-related recovery capabilities. Many men maintain daily or even multiple daily intimate self-care patterns from their younger years, not comprehending the physiological changes that make this harmful after 60. Here is the urological science behind this concern. Your prostate generates approximately 30% of your seminal fluid, including essential enzymes and proteins. After 60, your prostate requires significantly more time to replenish these secretions. When you engage in intimate self-care too frequently, you essentially force your prostate to work excessively, which may lead to inflammation, discomfort, and potentially contribute to benign prostate enlargement. Additionally, your hormonal cycles undergo dramatic changes after 60. Frequent climactic experiences may disrupt your natural testosterone patterns, resulting in fatigue, mood alterations, and decreased libido. Over time, your luteinizing hormone and follicle-stimulating hormone levels also become more susceptible to disruption. I have observed men who engage in daily intimate self-care after 60 develop what I identify as ejaculatory fatigue syndrome, where each subsequent climax becomes less gratifying, requires longer to achieve, and leaves them feeling depleted rather than satisfied. Based on my clinical experience, the optimal frequency for most men over 60 is every 48 to 72 hours. This allows your prostate time to recover, your hormone levels to normalize, and your nervous system to reset. Some men discover that spacing sessions even further, perhaps twice weekly, provides the most satisfying experiences. I have had patients who reduced their intimate self-care frequency and found their experiences became significantly more pleasurable and fulfilling. They reported more intense climactic experiences, improved energy levels, and enhanced mood. Quality over quantity becomes increasingly vital as we mature. The third mistake involves attempting intimate self-care without adequate lubrication. Many men believe lubrication is only necessary for vaginal intercourse, but this is medically incorrect, particularly after 60. As testosterone levels decline, your body produces less natural lubrication during arousal. The pre-ejaculatory fluid that once provided some natural lubrication becomes minimal or may disappear completely. Simultaneously, the skin of the male organ becomes thinner and more vulnerable to microtrauma. Dry, intimate self-care creates friction that may cause microscopic skin tears, tears so minute you cannot see them, but large enough for bacteria to enter. These micro-tears serve as entry points for bacteria, potentially leading to infections, inflammation, or conditions like balanitis, inflammation of the glands. I have treated numerous men over 60 who develop recurring infections because they never use lubrication during intimate self-care. Some developed chronic inflammation that made any sexual activity painful. Even more concerning, repeated dry friction may lead to scarring of the penile skin, which reduces sensitivity permanently. I have observed men who developed what is essentially scar tissue around the glands from years of dry, intimate self-care. From a urological perspective, the solution is straightforward. Always use a high-quality, unscented, water-based lubricant before beginning any self-stimulation. Apply it early in the process, not as an afterthought when friction becomes uncomfortable. Avoid products containing glycols, parabens, or artificial fragrances, as these may cause irritation in sensitive aging skin. Also, avoid oil-based lubricants if you use condoms with partners, as oil can break down latex. Some specific products I recommend to my patients include brands like Good Clean Love, Aloe Cadabra, or simple pharmacy options like KY Naturals. The modest investment in proper lubrication can prevent significant medical problems in the future. Now let me provide you with my complete protocol for safe, intimate self-care after 60, what I call the CARE method, with specific positioning and technique recommendations. C represents cleanliness and comfort. Always wash your hands thoroughly before beginning. Ensure your environment is clean, private, and comfortable. This is not merely about hygiene. It signals to your nervous system that it is safe to relax. Consider your position carefully. Avoid sitting on hard surfaces that may compress nerves. A reclining position or lying on your side often works optimally. A represents appropriate technique. Apply lubricant first. This is non-negotiable after 60. Begin with light pressure and slow movements. Use your entire hand, not just fingers, to distribute pressure evenly. Allow your arousal to build gradually rather than forcing it. If your grip tightens unconsciously, pause and reset. Consider alternating hands or changing your grip position every few minutes to avoid repetitive strain on any single area. Some men discover that using a sleeve or textured device designed for men can provide stimulation without requiring a tight grip. R represents respect timing and recovery. Allow 15 to 20 minutes minimum for the complete experience. Do not rush toward climax. Let arousal build naturally, fade, and return. This wave-like pattern is normal and often more satisfying than a direct approach. Follow the 48 to 72-hour recovery rule between sessions. E represents evaluate constantly. Pay attention to your body's signals during and after intimate self-care. Any unusual pain, changes in sensation, or unexpected responses deserve medical attention. Speaking of medical attention, here are the specific warning signs that require immediate evaluation by a urologist. First, any pain during or after intimate self-care that persists more than 30 minutes, especially if it is sharp, burning, or worsening over time. Second, sudden changes in sensation, new numbness, burning, or tingling that does not resolve within several hours. This could indicate nerve compression or damage. Third, visible changes including swelling, discoloration, unusual bumps, or any discharge that persists beyond 24 hours. Pay particular attention to any discharge that is yellow, green, or has an unusual odor. Fourth, urinary symptoms including difficulty starting or stopping urination, changes in flow strength, pain during urination, or increased frequency that coincides with intimate self-care. Fifth, any bleeding, regardless of how minor it appears. This could indicate skin tears, irritation, or more serious underlying conditions. And sixth, persistent changes in erectile function. If you notice that you can no longer achieve erections during intimate self-care when you previously could, this may indicate circulation problems that need evaluation. Do not hesitate to contact a urologist about these concerns. We have encountered everything. Early intervention prevents minor issues from becoming major problems. Intimate self-care after 60 can be a healthy component of your self-care routine when performed correctly. It supports prostate health, maintains circulation, reduces stress, and helps preserve sexual function. However, it requires adapting your technique to match your body's changing needs. Remember the key principles: slower, gentler, less frequent, and always with proper lubrication. Your body has earned your respect and care. This is not about performance or proving anything. It is about maintaining your health and staying connected to your body in a positive way. If this urological guidance was helpful, subscribe to Vital Hormone for more evidence-based men's health information. And please do not suffer in silence if you are experiencing any concerning symptoms. Your sexual health is an important component of your overall health, and addressing issues early prevents more serious problems later. Take care of yourself. You deserve to age with confidence, comfort, and dignity.